joins me now. Congressman Cotton, good morning to you.
Good morning, Chuck. Great to be on with you as always.
I want to ask you this. The federal government's a fairly large employer. The healthcare exchanges were not designed for large employers to do what they're doing. So you could make an argument that by taking away the exemption that was negotiated on a bipartisan basis, by the way, that you'd actually be making it unfair for members of your staff, not more fair. What do you say?
Chuck, what you just described may be what some Democrats wish the law said, but what the law says is clear, that members of Congress and senators and their staff have to go into the Obamacare exchanges on January 1. And there's no person in America on those exchanges who will receive an employer contribution towards their health insurance. And the Obama administration, under pressure from Senate Democrats, carved out a special deal for Congress in August to say that the federal government will continue to contribute 75% towards health insurance premiums. That is wrong, it's not lawful, and it's not right.
But why should let me ask you this, why should an employer, the exchanges are designed for people that don't have employer-based insurance. Members of Congress are employed by the federal government. Your staff is employed by the federal government. So it is common practice for large companies, large organizations, and the federal government is as large as any organization, to contribute to the cost of an employee's health care benefit. So what you're describing is you're basically saying, you know, no, there should be an exemption for just this one group of folks.
Chuck, Obamacare was passed with unanimous Democratic votes. The Democratic Party are the ones who decided to put senators and congressmen and their staff.
No, actually, it was a Chuck Grassley. Well, hang on there. It was a Chuck Grassley Republican amendment. So it was actually a Republican.
It was actually drafted by Harry Reid's staff in the final version, but that's all beside the point. It was clear the intent of the amendment. It was designed to ensure that Congress had to eat its own cooking, had to understand what it was like to live under the exchanges. Now that they have to go into the exchanges and they realize that the websites aren't ready, that there's no privacy protections, that there's likelihood to be data breaches, that you'll have less access to your doctors, Democrats in the Senate are refusing to take back the exemption that the Obamacare gave them. They had a simple choice. They could keep the government open, or they could keep their special deal. And they chose to keep their special deal. That's just not right, Chuck.
You keep describing it as a special deal. It's a special deal if you did it your way, because then you would be taking away something that every other federal government employee at a park service has. But what you're saying is if you work for the federal government because you work for a politician, you can't have that deal.
Chuck, the Obamacare law was clear. Congress should go into the exchanges so they could experience what it's like to live in the exchanges. If this special deal goes forward, Congress will be the only people in America come January 1 who have an employer contribution to their health insurance. Now, our staffers will have access to the tax credit subsidies that any other American would. If they make less than 400% of the poverty line, then they will be able to receive some assistance, the tax system. But if they make more than that, then like every other American, they'll have to bear the full cost of their health insurance. And Congress should have to follow the law that they pass and impose on the rest of America.
So what you're saying is do you think the federal government should dump everybody into the exchanges? Because that's essentially what you're saying, is that Congress, they have an employer-based health care system. They have an employer-based health care benefit. The point of the exchanges were for people that did not have an employer health care benefit. So you want to dump everybody into this?
This is not a debate about the entire federal system, Chuck. This is a debate about the people who write the laws, having to live under the laws. The intent of the amendment in 2009 was clear that congressmen and senators and their staffers who write the laws should experience what it's like to live under them. This is not about park rangers. This is not about any other federal employee. This is about the people who write the laws, having to follow the laws that they write and live by the system that they impose on the American people.
Now, it sounds like the carve-out you're saying is a carve-out for Congress. You're actually describing a carve-out in another way. That is a different type of carve-out. You're basically saying because you work for the federal government for a political person, for somebody elected to one branch of government, then you have to live under this way. Are you asking the Supreme Court, members of the Supreme Court, to do this?
I'm saying the law should simply be upheld as it's written. Obamacare was written to force all senators and congressmen and their staff to go into the exchanges without any employer contribution. And in fact, the Office of Personnel Management initially did not intend to make the contribution because it's clearly contrary to law. Only after Senate Democrats in a closed-door meeting pleaded with President Obama did President Obama personally intervene to create this special deal for senators and congressmen and staffers.
Now, you do realize there are reports out there that it wasn't just Senate Democrats, that House Republican leadership was involved in that meeting as well. Does that concern you?
And it was just days before OPM announced their new rule that Senate Democrats in a closed-door meeting with President Obama pleaded with him to personally intervene, and he did personally intervene, an extraordinary intervention from the West Wing into the operations of the day-to-day bureaucracy.
I want to ask you, I know you're